To Your Health, where we talk to local health leaders to help you feel better, live better, and be better.
Hey everybody, and welcome to Your Health. Well, today we're going to talk about hospice and why sooner is way better than later. Joined today by Dr. Amy James from Unity Hospice. Hi, doctor.
Hello.
I really wanted to talk about this today, but before we get into why sooner is better than later, let's maybe just set the ground rule. What's the philosophy on hospice?
The philosophy on hospice is focusing on caring for somebody when they're approaching the end of their life. When the treatments they're getting, the interventions are maybe causing more harm than good, eliminating or decreasing their quality of life, and when someone's ready to focus on being comfortable, staying home, managing symptoms, and living out their however long as best they can.
And what we really wanted to let people know today, right, is that if you start that a little sooner, there's so many benefits. What are some of those?
Well, the sooner we get to know somebody, the better our rapport with them is. We create trust. We create a trusting relationship that helps us anticipate the patient's needs. We can better manage their symptoms. We get to know their family. We get to know how they work together. And that's huge. Now,
what time frame would we think about? If we say sooner is better, what does that time frame look like? Is it different for everybody?
So the hard and fast definition that was given to hospice when it was created was for people who have a life expectancy of 6 months or less if the disease runs its natural course. Not sure what a natural course is because we're all individuals. But within some parameter of 6 months or less, and nothing is for sure.
Right.
That changes.
That changes. One thing, again, when we talk to people, there's this huge myth that's negative about hospice, and I really wanted to ask you about that. What is that myth? Why is that looked at negatively?
So the myth is that hospice hastens dying. And what literature research has shown is that because it's a hard topic, because we don't want to talk about it, we wait, and don't bring it up until it becomes obvious. And then we offer hospice, and then the patient dies. And so it's that lead time bias where you think, well, hospice came, now they're gone.
Right.
But it's getting over that unease of talking about it.
And we have to get through that to get to all the emotional and all the beautiful help that hospice brings, especially from the angels at Unity. And lastly, people ask, what is the cost?
Hospice doesn't cost anything unless you have private insurance, and then there might be a deductible or copay, but Unity will provide care for you regardless of your ability to pay.
Well,
we don't
doctor,
turn anyone away.
That's wonderful. Thank you so much for joining us, and thank you for watching To Your Health.
The preceding was a paid advertisement.